Hi, my name is Alice Ye, and I serve as the Evaluation Coordinator for the Center for Evidence to Practice. And today I will be presenting my abstract on driving Louisiana's behavioral health workforce to better outcomes. The mission of our Center for Evidence to Practice is to better support our Louisiana behavioral health providers working with Medicaid populations by using evidence-based practices. In collaboration with the Office of Behavioral Health, our center offers the following trainings in evidence-based mental health practices, including but not limited to EMDR and TFCBT, which are more focused on treating trauma. Our center was first established by Dr. Phillippi in 2017, who, after having issued the 2016 survey of youth-related services, found that less than 60% of mental health services delivered under Medicaid coverage utilized some sort of EBP and reported significant gaps in implementation. The results of the survey that we will be focusing on in this presentation will be from that of the 2024 Behavioral Health Survey, providing a retrospective look at how our youth behavioral health landscape has changed since 2016. Some of the objectives that we hope to accomplish in issuing our survey were 1, identifying systemic strengths, 2, challenges, and 3, gaps in supporting evidence-based practices. The way we went about this was first obtaining Louisiana Youth Medicaid data from January 2023 to June 2024 from the Office of Behavioral Health and aggregating the data by top mental health disorders. Then creating questions for a 2024 survey that also included questions from the MASLAG burnout inventory, specifically used to measure burnout in providers. Afterwards, we transferred all of those questions from our survey onto REDCap, where we then shot out our survey to our listserv and by proxy, the external contacts. Finally, after collecting all of our data, results of our 2024 survey were analyzed. This is a flow diagram made by our PhD student of survey participation, broken down by agency and provider. And as you can see, we had a total of 451 surveys opened. And of those 451, agency leaders that completed the survey were 79, and we had 189 providers complete the survey in entirety for a total sample size of 286. Results of our study showed that most of our study sample, specifically 75%, serves the Medicaid population, and these providers actually reported high professional satisfaction and low emotional exhaustion. Also, this high professional satisfaction was further supported from results from the MASLAG burnout inventory, as shown here in this bar graph, indicating that over half of the providers reported moderate to high personal accomplishment, as demarcated in the yellow bars. We also showed an increase in EBP utility from 2016, implementing EBPs as reported by 94% of providers and 78% of agency leaders in our sample pool. Some of the top areas we encountered were funding payment, lack of an adequate workforce, and difficulty in reaching these hard-to-reach populations, suffering from the worst health outcomes. Additionally, we found that only 5% of agencies offered financial incentives for EBP. This is a snapshot of the top disorders that we analyzed in the Medicaid data. 56 of the claims were related to hyperkinetic ADHD disorders, 11% depression, and 11% conduct and mixed disorders, further emphasizing the importance of EBPs. Some of the recommendations that we recommend based on our findings are 1, reducing licensure-related financial barriers, 2, expanding access to EBP training, and 3, promoting EBP practices. In conclusion, we found that this survey that helps us to better understand provided reported strengths and challenges, as well as figuring out solutions to these barriers so we can promote sustainability statewide. I'd like to thank these members of my team as well as our external consultants. Thank you.